Assalamualaikum warahmatullahi wabarakatuh. Today I'm going to talk about leptospirosis. Leptospirosis is a blood infection and bacterial disease that affects humans and animals. It is caused by bacteria of the genus Leptospira. The bacteria that cause leptospirosis are spread through the urine of infected animal, which can get into water and soil and can survive there for weeks to months. The bacteria can enter the body through skin or mucous membrane such as eye, nose, or mouth, especially if the skin is broken from a cut or scratch. Drinking contaminated water can also cause infection. Outbreaks of leptospirosis are usually caused by exposure to contaminated water such as food water. There are two different types of leptospirosis and their symptoms. Mild leptospirosis can cause a wide range of symptoms including headache, fever, diarrhea, jaundice, and rash. Most people recover within a week without treatment, but around 10% go on to develop severe leptospirosis. Symptoms of severe leptospirosis will appear a few days after mild leptospirosis. Symptoms depend on which vital organ are involved. It can lead to kidney or liver failure, respiratory distress, and meningitis. If leptospirosis affects the heart, liver, and kidneys, the person will experience fast heartbeat, muscle pain, nausea, nosebleed, swelling of the hand, feet, and ankle. Without treatment, this can lead to life-threatening kidney failure. If it affects the brain or spinal cord, meningitis and encephalitis may develop. Meningitis is an infection of the membrane covering the brain and spinal cord, while encephalitis refers to infection of brain tissue. Both conditions have similar symptoms such as confusion, drowsiness, seizure, high fever, nausea, photophobia, stiff neck, inability to speak, unusual behavior, and have problems with physical movement. If it affects the lung, the person cannot breathe. In severe cases, there may be so much blood that the person suffocates. For mild leptospirosis cases, the doctor may prescribe antibiotics such as doxycycline or penicillin. Patients with severe leptospirosis will need to spend time in the hospital. They will receive antibiotics intravenously depending on which organ leptospirosis affects. The individual may need a ventilator to help them breathe. If it affects the kidneys, dialysis may be necessary. Intravenous fluid can provide hydration and essential nutrients. Hospital stays may range from a few weeks to several months. This mostly depends on how the patient responds to antibiotic treatment, how severely the infection damaged their organ. During pregnancy, leptospirosis can affect the fetus, including fetal death or abortion. Anyone who has the infection during pregnancy will need to spend time in the hospital for monitoring. The risk of acquiring leptospirosis can be greatly reduced by not swimming or wading in water that might be contaminated with animal urine or eliminating contact with potentially infected animals. Protective clothing or footwear should be worn by those exposed to contaminated water or soil. Avoid contact or touching that animal with bare hands. Then, after handling animals, wash hands with soap and water. Lastly, avoid drinking water from lakes and rivers unless it has been boiled or chemically treated. Prevention is better than treatment, so we need to stay healthy and stay safe. That's all from me. Thank you.